the ability for the patient to shop is one of the key themes for this movement. And Tim Murray and his practice is a key part of that. So Tim, I would like to just, if you could share a little bit about what you've done and what your practice is about. We'll start there.
Sure. Appreciate you having me, Matt. Yeah, we actually started Solstice Health in 2012. We were a little ahead of ourselves, I think, in 2012. But we started a practice that we wanted to change the way that we deliver healthcare because we saw so many issues with it, not only on the regular clinical side, but also on the operating room side of things as well. So we started out with our first direct primary care clinic in Oconomowoc, Wisconsin in 2012, opened up a second one a few years later in New Berlin, Wisconsin, Brookfield area, and now we have a third one in the Milwaukee market. The third one, we were patient for 10 years. Always wished we could have done it sooner, but I think honestly, the way that I think God sort of led us and opened and closed some doors for us along the way allowed us to open it just this last year. We had a soft opening a year prior to that, doing some cash-based surgery, but we really wanted to continue to implement the model that would be cash-based, that would offer affordable prices and higher quality at the same time. And so now we have our surgery center along with the three clinics together all under one umbrella, which is nice because we can start on the primary care side, and if we have someone who happens to need surgery, we can refer them to one of our specialists and be able to do the surgery all internally as well.
This model of basically cash-priced healthcare, which could be funded by a self-funded employer. So it's not just like you walk in and pay with cash, but kind of outside the insurance realm, if you will. This was pioneered. They didn't even start there, but they went there in the middle of their journey by the Surgery Center of Oklahoma, Keith Smith and Steve Lantier. And so they were kind of the pioneers in the country, and then others followed, like yourself. There's Wellbridge in Indiana. There's one starting in Idaho, and I think there's one in Texas, and others scattered across the state. Yeah, so this free market healthcare. So how cool is that we have kind of an SEO-like operation and practice in Milwaukee? So I'd like to lead into maybe the big question. So this is the question I get all the time, and I can give my layman answer, if you will, but it's not nearly as good as your answer from an MD. So I'll tell you, I'll lead it off with this. I was in an open enrollment meeting or an education meeting once at Merrill Steel, and I was talking about how we can purchase, say, orthopedic surgeries, for instance, for 20, maybe, give or take 20% of what you would pay at the hospital. And and one person who's kind of a jokester, and he kind of spoke up and he said, "So is this that Motel 6, ask for Vinny in the back?" And we all laughed, including me. But can you shed some light on this topic of how in the world can you offer high quality, if not better quality, surgeries, but at such a fraction of the price of hospitals?
Sure. Yeah, as I've sat in the operating room over the years, some smaller, some larger, you see a lot of things that the hospitals leverage nursing staff and other staff internally to do a lot of their billing, et cetera. And you start to hear these things going on where, just for an example, smaller hospital, rural hospital, doing a knee arthroscopy, an ACL repair, needed a knee immobilizer at the end. And I think one case we did that was about $200 because you sort of see all the billing that they do internally, or you can if you're interested. Most people aren't interested. I was always interested. And one case was $200. Subsequently, the hospital lost $3 million in rural subsidies. And the same knee brace, I think they charged out at like $1,000 in a different case. And so it really is true. And we sort of joke about it on the back end as well, but there's this charge master that people always talk about. And I envision this charge master of sitting on a little round table in a dark room with a beam of light coming down on it as the Bible, and they can just page through and change prices as they want. And the reality of it is that's exactly what it is. Without all the sort of optics around it, but the prices are changed according to what the needs are. And so when you see these things and you start to realize what the true cost of healthcare, and you realize that honestly, when you look at a direct primary care clinic as well, you look at, for instance, buying 1,000 pills for $16, and so your prescriptions are maybe around 40 cents a month or $1 a month. The same is true on the surgical supply side of things, and so that's how, when you really get into the nuts and bolts of what a surgery is going to cost, it doesn't cost as much as they say it's going to cost, but they're billing all this additional pork, if you will, to pay for a lot of other things, including CEO and all the executive salaries of $13 million, $10 million, and so on down the line as these people progress down. And a lot of it too is just the building that, that associated with sort of these not-for-profit. And you mentioned Keith Smith, who I consider sort of the godfather of non-insurance-based surgery. And he will often tell you that he doesn't call it a not-for-profit, he calls it not show-a-profit. And that's exactly what they are, because they have to continue to spend this money in such a way that they're building all of this excess. And so when you start to have all this real estate and all these additional clinics and things like that, you start to have to charge more money. And the insurance companies will bear that cost and continue to pay for it. So again, from our standpoint, when you look at the back end of it, we know exactly what the costs are. We control those costs. We control the real estate, and therefore we can offer these surgeries at 70 to 80% less than the hospitals do.